Hello, my name is Alex Breen and I would like to thank the European Society for Biomechanics for allowing me to present my work on a kinematic analysis of dynamic lumbar spinal rhythms during flexion and return to neutral. Lumbar spinal rhythm refers to the coordination of motion between lumbar vertebrae during a physiological movement of the body. It is the percentage contribution of each level to the motion of the spine. The work of our group has been largely focused on the measurement of intervertebral kinematics of the lumbar spine in vivo. Our motivation for doing this has been a desire to provide a more detailed normative information that could be used to support dynamic biomechanical models of the interactions between vertebrae during motion. These are also affected by a number of factors, for example, muscular activity, ligament torques, compressive loads, and of course behavioral factors, such as under the influence of pain. In this work, we aim to build a normative database of healthy controls which individuals and groups of patients can be compared to. Historically, efforts to measure how the lumbar spine bends have involved either surface-based motion capture and/or static end-of-range images, estimating the rotational contributions to motion of each vertebral pair or section of the spine. Combining the surface-based motion capture and the contribution to end-of-range motion from static images, assuming that there are no positional errors or soft tissue artifacts in your skin-based measures. Predictions of how motion can be proportioned across the spine can be constructed. However, this is not what it looks like in vivo. This is because the contributions to motions are not consistent throughout the range of motion, as predicted here in the left-hand graph. What we find is that the contribution changes throughout the motion. So the aim of this work was to determine the level-by-level distribution of continuous contributions to intervertebral rotation from L2 to S1 during a standardized bend of a sizable healthy population, so that this could be used to drive models and perhaps compare with patients doing the same task who have spinal problems. We recruited 131 adults into this study who had had pain in the last year that had prevented them from doing their normal daily activities. They were also all under 70 years old and had a self-reported BMI of less than 30. The body mass index limit was to ensure images of sufficient quality to assure we could acquire the position of the vertebra throughout the sequences. Low-dose continuous fluoroscopic image sequences were acquired from each participant as they undertook an active weight-bearing flexion and return protocol which minimized accessory movements. Then, using a semi-automated image registration and vertebral tracking program written in MATLAB, we continuously tracked all 5 levels L2, L3, L4, L5 and S1. 4 participants were removed, or the data was removed due to image artifacts, leaving us with 127 complete datasets. Intervertebral rotations in the sagittal plane were extracted for each level L2 to S1 in each frame and transformed into percentage contribution as a proportion of the sum L2 to S1 angle. Mean and 95% confidence intervals across the participants were compared at each point of motion throughout the range of L2 to S1. Data was separated between flexion and return to neutral to distinguish the 2 phases. Statistically significant differences between each level's contribution to motion were detected by an absence of an overlap of these 95% confidence interval bands. Across the study population, each intervertebral level has its own characteristic motion signature, with significant differences between each level's contribution throughout the motion despite their variability. These patterns are likely related to a combination of loading, motor control, and interjoint properties. If we consider just outward flexion, it is possible to generate some comparisons with segmental contributions reported in the literature from static or quasi-static imaging studies. The proportion of motion performed by each levels at moderate or full flexion is similar to these previous studies. And also notes that it is different between moderate and full flexion. And for those studies where continuous motion is available, such as Wong 2006 and Iyengar 2015, our results are comparable. Particularly for the return phase with Iyengar 2015, where we find that there isn't much of a change in the contribution to motion across the range, but it is actually a significant amount. Moreover, our results show in detail the differences in the contributions to bending throughout the motion, both between levels and within levels as participants progress. Here we see a significant changes to the contribution over the course of the motion, with the exception of L3-4, which seems to remain consistent throughout. This is the largest data set available to date to present normative values for continuous contributions to motion of the lumbar spine. Unlike previous studies of a similar size, Wong 2004, we find that contributions to motion vary throughout the bending task, especially flexion. The percentage contribution to motion, both in flexion and return, was also shown to be distinctly different, as one would expect with the different muscle contractions. It is our hope that these findings are of benefit to biomechanical models and their validation. We would also wish to use this database to compare patients with low back pain, which may be related to their motion. It is our plan to take this further, and future analysis will include the use of statistical parametric mapping to compare the whole kinematics time series between levels contributions to motion. Thank you very much for listening, and if I don't catch you in the forums, my contact details are just here, and there's a QR code that will take you to our website.